Hi everyone, in this video I'm going to be talking about post-concussion syndrome or PCS. Basically this is where we get symptoms that last beyond the expected recovery time for a concussion of about 4 weeks. It occurs in about 30% of people that don't get that appropriate care post-concussion. And I'm going to break down the main reasons why this may occur and how we can target these areas to help resolve any lingering issues. So first one is blood flow. When we get a concussion, we get impaired blood flow to the brain. This can result in symptoms that come about when we place strain on the cardiovascular system. So things like exercise. We test for that within the clinic with specific exertional testing, which can give us an idea of what intensity exercise might be provoking someone's symptoms and help us prescribe the correct exercise to help resolve the symptoms related to those blood flow issues. Next one's metabolic. So when we get a concussion, we go into an energy deficit, and that can, in rare cases, be a cause of lingering symptoms. It's not very common though, just because it only really occurs in people that haven't had adequate rest, which most people have. But if you are, or someone is in that small percentage of people that hasn't had adequate rest, then we may consider prescribing that to see if that helps resolve symptoms. Next one's inflammatory. So when we get a concussion, there's inflammation within the brain. That's a normal part of the healing process. We need that to happen, but sometimes it can turn into more of a chronic inflammatory cycle where inflammation creates more inflammation and so on. So we tackle that with evidence-based and research-backed dietary changes and supplementation to try and break that inflammatory cycle and get on top of that inflammation. Next one's visual vestibular. So a range of visual vestibular issues can occur following a concussion. Things like balance issues and sight issues and dizziness and things like that. We test for that in the clinic with our VOMS testing, which can provide an idea of what, more specifically, what might be causing those issues, and also help us to prescribe specific rehab, exercise rehab, to try and get on top of those symptoms related to the visual and vestibular systems. The next one is neck. So to get a concussion, we need about 70 to 120 G of force, but to get a whiplash, we only need 4.5 G of force. So if you're getting a concussion, almost definitely getting some form of whiplash as well. So whiplash can present nearly identical to a concussion, and maybe is a reason why those symptoms are lingering. So we'll test that and assess for that in the clinic and provide the appropriate treatment to get on top of those symptoms that may be related to the neck. Next one's psychological. So things like anxiety and fear and depression are not uncommon following a concussion and can actually enhance a lot of symptoms related to concussion. So a big part of management is trying to sit down with the patient, try and understand their concerns and anxieties around their concussion, and provide the appropriate education and advice to help alleviate those concerns and anxieties around their concussion. So that's a pretty brief overview of what's actually happening with PCS. I hope that gives a clearer picture of how we can target and manage those symptoms. If you have any questions related to it though, feel free to reach out and we'll be happy to chat about it.